Welcome everyone. Thank you for joining us today. I'm Teresa Marantat, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 222,887 confirmed cases of COVID-19 in Canada and 72,051 cases in Ontario. Chatham-Kent has 401 cases and Sarnia-Lambton has reported 369 cases. Michigan now has 164,274 cases, with 15,376 cases being in Detroit. Today, we are reporting 3 new cases of COVID-19 in Windsor and Essex County. 2 are close contacts of a confirmed case, and 1 is still being investigated. We have had 2,815 cases since March. 2,697 cases are now resolved and 42 cases are active and being followed by our health unit. 2 people are currently in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There are no long-term care homes in outbreak at this time. 2 workplaces remain in outbreak, 1 in construction and 1 in the food and beverage industry. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit your number of contacts. Keep a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering if you cannot maintain a 2-meter distance from others. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. Download the COVID Exposure Alert app at www.canada.ca. Testing is available by appointment at selected pharmacies and assessment centers. Please call in advance to book your appointment and determine your eligibility. Windsor has 3 assessment centers: Windsor Regional Hospital, OLEP Campus, St. Clair College Sportsplex, and Erie Shores Healthcare in Leamington. And SOHAC in Windsor offers testing for First Nations, Métis, and Inuit people and their families. Just to provide an update on the flu vaccine in our community. Our health unit has received over 95,000 doses of vaccine from the Ontario Government Pharmacy. This includes high-dose vaccine for those over 65 years of age and also the vaccine for the general public. To date, we have distributed the majority of the vaccine to our healthcare providers and continue to get vaccine shipped to us weekly. Individuals should call their healthcare provider to book their appointment, and if the healthcare provider doesn't have enough vaccine, they can visit their local pharmacy. There is a flu shot locator for participating pharmacies, which can be found on our website, www.wechu.org, Your Health Where Get Flu Shot. Vaccine will continue to arrive in our community over the next coming weeks. Healthcare providers can begin reordering their vaccine once they have depleted their current supply and by contacting our health unit. Families and children under 5 years of age should contact their healthcare provider to obtain the vaccine because they're not able to get that at the pharmacy. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, everyone, and thank you for joining us again. Case and contact management is critical to control any infectious disease, let alone the pandemic. Within the health system, there are many hospitals and healthcare providers who provide clinical care to all COVID patients, but the case and contact management is only conducted by trained public health staff. Under the Health Protection and Promotion Act, Ontario Regulation 559/91, any suspect or confirmed diseases, for example, measles, mumps, pertussis, chlamydia, gonorrhea, TB, or even COVID, must be reported to local public health unit by all physicians, laboratories, administrators of hospitals, schools, and institutions. The legislative authority is critical in controlling all infectious disease in community in order to prevent any spread of the disease in the community. In the absence of these notification, the disease can continue to spread and lead to hospitalizations and death in the community. When a case of reportable disease is identified, public health departments with its trained staff in case and contact management, infection prevention and control, epidemiology, environmental health, and public health physicians immediately initiate a case and contact investigation to ensure that there is no ongoing threat of the disease spreading in the community and identify all contacts to contain the disease before the infection spreads to others. Clinical management of patients is generally done by primary care providers and public health, but public health is generally there to consult and provide recommendation based on the available guidelines. Since most COVID cases only require supportive care, case management is focused to ensure that the symptoms do not worsen and patients do not have any acute healthcare needs, such as hospital or ICU admission. When it comes to public health case management, the focus is to identify possible source of disease acquisition, and the trained public health nurse then investigate and interview the case and help them to recall all their activities in the last 14 days to identify high-risk exposure or a high-risk event where the exposure may have occurred. In situation when a high-risk exposure or a high-risk event is not identified, the cases are classified as the community spread. As I reported last Friday, in our community, we still have roughly 25% of the cases that are attributed to community transmission, but most of these cases are identified as close contacts. One of the other goals is to identify all the contacts that have been exposed when the case itself was in his infectious period. All these contacts, when they're identified, they may or may not develop the disease, but require close monitoring by public health, or they are advised to do self-monitoring for themselves. So who are COVID contacts? COVID contacts are individuals who have spent a significant amount of time living together with a person while the person was infectious with COVID disease. This may include the household contacts, friends, co-workers, others in different settings, for example, cellmates, shelter residents, bunkhouse residents, long-term care home, retirement home, etc. And in some situation, there could be other type of exposure in a business setting or in a place where they may have spent a little bit of time with someone in close proximity. So how do we do a contact tracing once we get a positive case identified? Our nurses and team of public health contact tracers immediately get in touch with the contact to get more details. So in this example, what we can see is with this case, we have identified 2 households and 3 close contacts. And upon investigation, what we also notified that out of these 5 close contacts, 4 of them are symptomatic. And then upon testing these 4 individuals, 3 of them turned out to be a positive case. And then when we talk more to these close contacts, they have identified additional contacts with some of them exhibiting symptoms, and then when they're tested, some of them came back positive. So that's how the contact investigation typically works in our setting. But the question is why it is important to do contact tracing, and I briefly touched on that as well. Contact tracing helps to identify individuals and prevent any further spread in the community. And if the contacts are not identified, they continue to expose other people to the virus that can lead to widespread infection in the community. In this example, if person A actually had 2 contacts but only identifies person B and fails to identify person C, this is how it will play out. Person B, once identified during the incubation period, will be isolated. When person B develops symptoms, he or she will not be able to spread it to anyone else since she is not in close contact with anyone. On the other hand, person C, while incubating the virus, infects person D when the symptoms were mild, and since person D was not self-isolating, they continue on to infect person E and F, and if these cases are not tested or feel the need for testing because in their mind they haven't had any high-risk close contact or didn't come across with a confirmed case of COVID, they will continue to spread on to other people and the spread continues in the community. When we are doing our contact management based on exposure, we identify contacts into 2 distinct categories, high-risk contacts and low-risk contacts. Among high-risk contacts, household contacts, anyone who live in the same household, while the case was not self-isolating and infectious, they will automatically be identified as a high-risk close contact. When it comes to community or workplace contacts, there are more consideration given to it. Anyone who comes in direct contact with the infectious body fluids of the case, for example, coughed on or sneezed on, they will automatically be classified as a direct contact. And other who have had close contact, which is less than 2 meters, prolonged for more than 15 minutes without any mask or without any personal protective equipment in this type of setting. When it comes to low-risk contacts, so all household contacts, when the exposure is happening, when the case is self-isolating, and the case is applying consistent and appropriate precautions to protect others, all those households can be classified as low-risk contacts. When it comes to a similar situation in the community and workplace, if anyone who has a prolonged contact only, but while the case was consistently physically distancing, for example, attending at a gathering, co-workers in a common work area, or having any transient interaction, for example, walking by the coast or being briefly in the same room, they may all be considered as low-risk contacts. That means they have a low probability of developing the disease, but they do have some public health action that they need to follow. So I put together the scenario, and in this scenario, Mr. John Smith, our index case, possibly acquired the disease through community transmission, so we don't know where the acquisition happened. And then Mr. Smith have 3 family members. They will be considered as high-risk close contacts, and they all have to self-isolate. In addition, our case investigation reveals several situations that needs to be addressed and followed up. In this particular situation, close contact B works at a retail store. Close contact A attends an elementary school in Windsor-Essex, and close contact C attends a university in a different city. So upon investigation, if Mr. Smith's day out and potential contacts during his identification. So what we found that workplace, Mr. Smith attended his workplace and followed all the appropriate infection prevention protocols while at work. He maintained his 2 meters distance and had a face covering at all times. All those contacts at the workplace will be identified as a low-risk contacts. And then he spent almost 1 hour in the lunchroom, break room, with another person with no face covering, with intermittent physical distancing when they are crossing each other and coming across to each other, and the duration cannot be identified that how the risk, how close the encounter was. And in this particular situation, it was deemed as a high-risk close contact. And then Mr. Smith went on to the retail store for shopping and spent an hour at the retail store. He had a face covering on for most of the time at the retail store and tried his best to maintain 2 meters physical distancing when we know that sometimes when crossing people, it may not have happened. So in those type of situation, what happens, it triggers a notification for exposure notification, and the contacts who visited the retail store at that time can be considered as low-risk contacts. And then Mr. Smith also went to a gym for exercise, and he didn't attend any classes and wore face covering in the common area. And in this particular situation, they were all identified as all low-risk contacts as well. So now looking into the story of household contact B, who works at the retail store, do not recall being sick or report any symptoms at the time of the interview, and not identified as a case yet. They was advised to self-isolate since identified as a high-risk close contact of a confirmed case, and no further action needed at the workplace or anywhere for this particular contact. Now looking at household contact C, who is a school student and attends an elementary school, was complaining of cough and runny nose yesterday and stayed home. And today was advised to get tested for COVID, but attended the school the day before the symptoms started. So the results came back just today, which is negative for COVID, and the symptoms are improving. The question comes, what about the class contacts? Is there any risk? So based on the investigation, yes, this particular individual is a high-risk close contact, but was and also had symptoms. But when tested, the symptoms, the test result was negative for COVID, and there is no other exposure that is identified. So technically, we can assume that this particular student has had no ongoing risk for COVID, and this runny nose and cough could be a symptom of allergies or anything else. And but the chances is he could still be incubating the virus. So in this situation, the close contacts at the class are not identified as a high risk or no risk at all, because there was no, the child was not infectious at that time. And then since C is negative and it still need to self-isolate because they are a high risk contact and they must be incubating the virus at the time of testing. So now looking into the household contact D, university student. University student D lives in a shared apartment with 2 other roommates in London. He came to meet his family and left the day his father had mild symptoms. At his apartment after returning, he was having headache and didn't go to the university. The next day, he started coughing and had mild fever. He immediately self-isolated himself from his 2 classmates and went for testing. And his test results came back the next day, and he's now positive. The question comes in, what about his roommate? They're all identified as high-risk close contacts because they shared the same living space for a longer period of time where physical distancing was probably not maintained because they're all roommates. His roommate also attended astrophysics lecture at the Western University with 20 other classmates with appropriate physical distancing and face covering when it's needed. The question would be, what about their classmates? Are they at risk? No, they're not at risk because the 2 high-risk exposure or 2 close contacts of these household contact D, they were probably incubating the virus and not infectious at that time because they didn't even have any symptoms. So they were not advised to isolate at that time. So using this example, what does it mean for the high risk and close contacts? And our team, when we are speaking to our community, when the people are identified as high risk versus low risk, and we always run into this question, am I a high risk, am I a low risk, and what do I need to do? So for all those high-risk close contacts, they have to self-isolate. There's a strong possibility that they will convert into a case. So they have to isolate, they do not attend school, they do not go to work, and they avoid close contacts, even with others, including those within their home, as much as possible, so that even if one person is infected, they are not spreading it to anyone else in the same household. We generally provide a self-isolation fact sheet advice, and it's also available on our website. We ask them to follow those advice. It gives you some tips and tricks how to self-isolate appropriately without putting anyone else at risk. We also recommend that you have to have a supply of procedure surgical mask available if you are in a situation where close contacts with others cannot be avoidable. So you may want to use all those personal protective equipment to protect others. If you have any kind of elective healthcare needs or any other type of appointments, you must postpone all these elective meetings, elective appointments unless you're advised by public health. You must use the private vehicle if you need to attend a medical appointment, or especially a medical appointment. All other appointments must be canceled. When a private vehicle is not available, private or hired vehicle that may be used while wearing a procedure surgical mask and sitting in the rear passenger seat with the window open, weather permitting, and do not take public transportation. You must always be available for follow-up and contact monitoring by a local public health unit. And if you're planning any type of travel, you must discuss with public health units before you make any travel plans. If you develop symptoms while you are isolating yourself, you must maintain isolation and immediately contact local public health unit and healthcare provider prior to visiting a healthcare facility. If your symptoms are severe enough, please call 911. If you're experiencing any type of difficulty in breathing or any issues with your with any other severe symptoms. So so for low-risk contacts, you must also follow public health guidance. It doesn't mean if you are identified as a low-risk contact that you will never develop the disease. Low-risk contacts can also develop the disease. Their likelihood that they will develop the disease is low, so that's why they're advised to monitor themselves regularly. And public health may or may not reach out to you in this situation, depending on the number of contacts and what we are dealing in and how we are identifying it. And these type of situation typically happens when we issue any kind of exposure notification. So if you're a person, let's say, visited the same retail store that Mr. John Smith visited while infectious, and even though while John Smith was wearing a face covering and tried to maintain their physical distancing, there is a possibility that he may have come in contact with someone. The likelihood of developing or converting into a disease is low, but because of the unknown risk, it's always a good idea to monitor your symptoms daily to ensure that if you develop symptoms, you can immediately self-isolate and the further spread of the disease can be stopped. And if you are, in addition to monitoring your symptoms, if you develop any symptoms, and if you need testing, follow public health as per provincial guidelines that when do you go for testing, what symptoms that you need to monitor, and then you need to contact public health immediately and self-isolate if your symptom develops, and public health can provide you with further direction how to arrange for testing or go for testing. So in summary, it is very important for public health to know all your contacts to make sure that we are not missing anyone in the community who could potentially develop disease and put other people at risk. And our contact tracing helps us to identify individuals who may have a high risk of developing a disease versus a low risk for developing COVID. High-risk contacts must self-isolate for 14 days to prevent any transmission, whereas the low-risk contacts are also at risk, but at a low risk, and they should self-monitor their symptoms for 14 days and go for testing immediately if they develop any symptoms. And overall, when we are talking about all these contact and case management, the key part still is and will continue to be reduce the number of close contacts and reduce the risk of contacting COVID-19 in our community. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with AM 800.
Dr. Ahmed, just with today's breakdown and the reminder, does it have anything to do with yesterday's numbers, how 9 are household contacts of a confirmed case? Is that why you want to get the reminder out there?
Well, it's a bit of both. I think we always remind people about the number of close contacts. Reducing the number of close contact is critically important. And also what our team is finding is not necessarily the high-risk close contacts. I think people get it. People know who is a high-risk contact and what they need to do. I think there is still some confusion with the low-risk contacts. And when people are identified as a low-risk contacts, maybe they do not think that they have to do anything. And we wanted to take this opportunity to remind that who are these low-risk contacts and how these low-risk contacts can also turn out to be positive. And if they are aware that they may have had an exposure with an event or maybe visiting a facility, and if they are showing any symptoms, that's their cue to seek healthcare, to maybe go for testing, and make sure that if they are developing the disease, even if it's mild, we are preventing further spread of the disease in the community.
So with yesterday's numbers and that 9 within one household, would all those 9 be considered high risk then? Or that's where I'm just getting a little confused.
Yeah, no, all those high risk close contacts, household immediately, unless, like, for example, if someone who is there and everyone else is do not have any symptoms, they are still high risk. And by the time if someone else comes in and never had any contact, and if they were wearing their personal protective equipment when they're there, there may be some distinction. But generally speaking, by definition, in 90%, 99% of the situation, if someone in your household developed a disease, everyone else is high risk close contact. There may be some instances, I don't want to complicate it too much, but 99% of the time, anyone you live in the same household, they're all identified as high risk close contacts.
Okay, thanks for the clarification. And then finally, I know there was other cases unrelated that were close contacts, but with the 9 yesterday, the 17 number, 3 today, I guess just your thoughts on the numbers the past couple of days here in Windsor-Essex.
Yeah, no, and that's a good point, Rob. And we're saying this, that these numbers fluctuate pretty much. And one day last week was our one of the best week when we reported happily that we didn't have any case. And this week we are now reporting 17 cases. So these numbers fluctuate quite a lot, and it reminds you that the diseases still exist. And whatever we are experiencing, whatever we are seeing right now, it can immediately change. And the good and bad part of the 17 is majority of them are all close contacts. So 12 of them are close contacts, which means that it's not 12 separate individuals who have acquired the disease separately in the community which would pose that there is an ongoing transmission that's happening out there with either people not knowing about their diagnosis or people who are not following their isolation recommendations and are spreading it to other people. So that is not happening, which is a good sign. But again, it can change very quickly, and as long as we're seeing these cases in close contacts and those numbers are not triggering any cluster or any community outbreak, we can still manage it, we can still contain it, and that's what our team is trying to do every morning when they're here. That's their number one priority, to make sure that we are preventing any further spread of the disease. We are trying to provide the right message, the right control measures to prevent any transmission, either intentional or unintentional, in the community, to reduce our case counts.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. You mentioned that it's very important for people to disclose all of their contacts, as you've said before. Are you finding that some people aren't getting it, that they may not be identifying everybody that they should be?
Well, we have had some instances where people may not recall all those details. So when we are connecting, our team are connecting with everyone, we try our best to spend a good amount of time getting all those details. But it's also important for an individual themselves to know exactly what they were up to in the last 14 days. Because it's easy, as I said, in my example, when I shared, person A had 2 contacts but identified only 1 contact, and it was not intentional. It could be an intentional one. They may forget that encounter completely. So it's possible. So from an individual perspective, as long as you know what you are doing, and that's where some of these messages again come in from public health, is when we are saying avoid some of these unnecessary meetings. Try to connect with people who you really want to connect, for like your close family members. You do not go to all these unnecessary parties that's happening, and you are not having all these high risk exposure events with many people. Because if you're avoiding that, what you are doing is you would know exactly who you come in contact with. You would also remember that who else could be at risk. And once we have all those pieces and details, we can act immediately and we can contain it. And as a community, when we are all doing our part, it would make it easier for our team, for everyone to identify how the case is acquired and who are the potential people who could be at risk. And if we do it well, we can contain it, we can keep those numbers down and bring it down to almost 0, ideally.
Thank you.
Any questions from Blackburn?
So thank you, the Albanist.
Any questions from CBC?
Yeah, hi. So, Dr. Ahmed, we asked you last week on Friday whether you were expecting any sort of bump in cases as a result of the Thanksgiving long weekend, and your response was basically that symptoms show up in 4 to 5 days. Basically, we would have seen it by now. But just with the 17 cases reported yesterday, I wanted to ask, what do you think now? Is there any evidence that this is the result of the Thanksgiving long weekend?
And it's hard for me to say if it was a result of the long Thanksgiving weekend. I think because there's a high number of people living in close proximity. It's a high household number, or the people who are in the same household was pretty high. And even it takes, and when we have seen that even in the agri-farm, it takes one person to infect everyone else. And a similar situation, what we have observed, that because of the high number of people living in one household, one individual, when they contract the disease, they are easily able to spread it to others. So I don't think that it's connected with the Thanksgiving weekend. I think it's just the matter of a number of people who are in close proximity to each other and in an enclosed environment that is very, very infectious environment, and anyone who is in that environment immediately gets the disease.
And just as a follow-up to that, with the 9 household contacts of a confirmed case from the same household, can you provide any additional information about what happened in that case?
I don't know what exactly I can share. The only thing that I can share is, these individuals who who work in some of these locations, and then they come back and they live in the same household, and being in close proximity to each other, they're able to spread it to others, and as a result, now we have almost everyone in that household infected.
Great, thank you.
Any further questions from AM 800?
Just one, Dr. Ahmed. I asked a similar question on Monday, but I got to ask again because yesterday the OEP sent out a release in regards to charging an individual for ignoring the Reopening Ontario Act. Officers were called to his residence, his or her residence, Sunday morning when they arrived, more than 50 people in attendance. This person got charged and they could face a fine. And then over the weekend, there was that rally and Windsor Police laid no charges. Are we sending mixed messages here?
Well, I don't know, Rob, if you were able to get in touch with Windsor Police, but as much as I can tell you is, again, without knowing what the circumstances are in each of these situations, I do feel that, these restrictions, these laws and these requirements are made to obviously to create that awareness that people should follow that, and obviously there has to be some action that should be attached to it. If these measures are there, if it's not enforced appropriately, I think we run the risk of people not taking it seriously. So I think anytime there is a clear evidence that something is not being followed, the actions need to take action needs to happen.
Thank you.
Any further questions from the Windsor Star?
No, thank you.
Blackburn?
No, thanks.
CBC?
No, thank you.
Thank you, everyone.
Thank you.